Testing 1 2 3. Testing 3 2 1.
All right, go for it. Let me bring up YouTube real quick. Hold on. All right, that sounds good, guys. Nice job. All right.
Good morning, all. Welcome, and thank you for being here today. The Finance Committee of the JPS Board of Managers will come to order. We'll dive right in. We do have a quorum. Let me pull up my agenda. Apologies for that. We're going to take a couple of things out of order. We have a special guest with us this morning, Mr. G.K. Manius. Is going to join us. We're going to cover, we want to move up an issue, so he's got a conflict at 10:30, so we want to get him an opportunity to make comments or respond to questions. So we're going to move an item up, but I want to go ahead and first ask if there are any citizens present who would like to address the committee.
No, Steve, we haven't received anything.
I'm sorry, David, what did you say?
We have not received any requests, so you're good to go.
Okay, thank you. Let's move to item 3 quickly, the approval of the minutes from the November 19th Finance Committee meeting. Do I hear a motion?
Move to approve.
We have a motion by Mr. Zimmerman, a second by Mr. Bose. All in favor, please say aye.
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 Opposed? Motion passes. Thank you. I'd like to move up, if it's okay with the committee, to move up item N. So we take that up. And let's see, who do I recognize on this one?
Me.
Me? Okay, me.
Me being Zelia.
Zelia.
Me being Zelia Ball.
Bama Bob.
That's right. Like I said, you need a little crimson on your horns.
Yeah, very little. Yeah, on my horns, but you just give me mine. Go ahead, Ms. Ball.
Good morning, members of the board. I'm here to present the interlocal FY21 agreement for your consideration of approval between Tarrant County and Tarrant County Hospital District for the funding of specified county programs. The cost is $17,685,172 annually. $16,260,059 was included in the approved FY21 operational budget, with an additional unbudgeted increase of $1,425,113 over FY20, primarily for services for inmates at the Tarrant County Jail. This will allow for the specified county behavioral health and public health services listed below to provide these services to the citizens of Tarrant County via MHMR and public health.
Okay. Any questions for Zelia?
I have a comment for Zelia that maybe she could answer for me. Zelia, I didn't see any quality data or quality metrics attached to anything for the jail portion.
Okay, Dr. Weber, so our agreement with the county is to transfer these funds to the county. The county, from what I understand, has an agreement with MHMR. And from what I understand, MHMR has proposed and the county has accepted multiple quality metrics for inmates at the jail.
So I missed the last few seconds.
So from what I understand, MHMR has proposed and the county has accepted multiple quality metrics in the contract between the county and MHMR.
Well, can we see them, or is that once they go to the county?
Well, that contract is between them and the county, not with us and the county.
Dr. Weber?
Yes.
Dr. Weber, what may be helpful, and I think Zelia, because I think the county sees obviously those are two different contracts.
Right.
You may want to ask, or you may want to ask that to Mr. Manius. Mr. Manius, you are more than able to communicate. You may be able to clear up some of the matters. So maybe some of the questions that Dr. Weber is asking, Mr. Manius, you can address, and probably would help.
Thank you. I appreciate the opportunity to speak before the board this morning. As Dr. Weber, Zelia is right. The contract that we're talking about here is a transfer of funds to the county. We then contract with MHMR to provide those services. There was, at one time, we were going to maintain the same metrics that we had been using in the past. There was a concern about several of those metrics, and we have revised those metrics. They have been a cumulative work between the Sheriff's Department, the Administrator's Office, MHMR, and the District Attorney's Office. Because of those discussions, and the Commissioner's Court was briefed on those increased requirements or metrics, it increased the amount of the request this year by a little over $1 million. I'll be more than happy once we execute these contracts to share that information with the hospital district. And Mr. Early and I have spoken previously about this also. If there is a desire for the hospital district to simply do an internal review of those metrics, we'll be more than happy to provide them and the various outcomes that have been established as MHMR, directs its resources with the Sheriff's Department to these various KPIs.
That would be great, GK.
Dr. Weber, I have seen those, and I was very impressed.
Great. I just wondered if we could have it part of the agenda for the quality committee or the full board, maybe just a once a year look at it, and I'd be interested to hear what other members think.
We'll be more than happy to share that information with the hospital administration and talk with the various board members as it relates to this.
Great, thank you.
So if I could ask a question, and I fully trust the metrics and the people who put the time and energy into crafting those. That's not my concern. My concern from a fiduciary responsibility as the finance chairman and passing the budget was the timing of the request, or not the request, but the transfer, I guess, the pass through is, we budgeted for a certain amount, and we were very diligent in figuring out what we were spending, and then we passed, after we've adopted the budget, we find out it's, there's 1.425 million unbudgeted. And I'm wondering what we can do going forward to address this kind of issue so we don't have this problem again where we're passing unbudgeted funding. Does that make sense?
Yeah, in fact, Steve, I'll be more than happy to address that. We initially thought that the performance indicators that we had established historically for this was something that we thought we could carry on. It would be a continuity of services, basically doing the same thing we've done in the past. We were not, when we submitted that piece or that request to the hospital district for funding, we were not aware that there might be some additional funding necessary for psychiatric services in the jail. Obviously, times have changed. Our jail population is not only increased, but the severity of the need of psychiatric services has increased substantially. Unfortunately, the timing on this was something that these KPIs or performance indicators had not been developed. Had we known this before October 1st, we would have put the hospital district on notice that there may be some change. Unfortunately, it didn't happen this year. I will tell you, and as I said, I've spoken with Mr. Early on this, we'll be more than happy to sit down every year like we do with public health budget to go over this and for you all to see what we plan to do and what those indicators are, and how MHMR has met those indicators in previous years.
Okay. Any other questions for GK or any Arzelia on this?
Steve, this is Trent.
Yes, sir.
Those of us who've been around a long time go through this every year. And I think one of the things I asked Robert, and I think he's visited with Daphne about, is the process of us addressing these budget items is completely different than the process of reviewing our own budget and all we adhere to relative to our budget. This is not something we have any control over in terms of how much money it is. It is literally a direct payment to the county. It's always been a direct payment to the county. I guess my question is, can we pull this out of our budget process and just do, whether it's a annual due from JPS to the county, or whether it's a GL entry? I don't know from an accounting standpoint, but it doesn't seem like we should continue to have to spend much time on this issue, because this is not something we have any jurisdiction over. I'd just like to see the money transferred based on what the commissioners approve every year and not even show up on it, honestly.
Yeah, I tend to agree. I mean, it doesn't make sense for us to vote on something that we have no oversight on. It's just, if it's a true pass-through, then let's make it a true pass-through and not a board item, you know?
Exactly.
And I think that the reason that we come to the board is because it's a transfer of assets from one governmental entity to another, and it was just the creation of a vehicle to make that transfer.
I'm all for the transfer. I'm just not for it showing up as a continued item of action that the board appears to have discretion over when we don't. I would rather just see it become an internal transfer every year, and it doesn't even hit our radar screen. Would be obviously my preference, and I'll defer to Daphne and Sharon and Robert on that. But you go through this every year, and the numbers come in, and we ask questions: why is the number different? The number went up, the number went down. We don't have any say on this, folks. We never have, and that's perfectly fine. This is the commissioner's decision, and they should get to make it. And honestly, I just don't see wasted time dealing with it.
Yeah, I agree with that.
Daphne, I know that we've had our discussions about it. Daphne's gone through that language. Daphne, why don't you mention some of the work, or at least the research you've done on this for the edification of the board members?
Yeah, and thank you, Mr. Early. So, and Sharon, I'll let you chime in as well, but I do agree that it can't just be a line item on the budget without having to go through the process of approving this as an interlocal agreement. The agreement itself, though, does kind of just iterate what the funding is for. So it's not really putting the district on the hook for necessarily providing the services directly. But I'll let Sharon chime in as well. I think we could handle it the way that you guys are describing here.
So from a budgetary standpoint, we do reach to the county in the summer as we're developing our budget process to gather those pass-through items. And we can work through how that needs to show up as a transfer of assets through the budget and on the financials as it actually occurs.
Yeah, I'd prefer that if we could do that next time. If it's the way of the board.
I would say also, just in adding to Chuck's point, if we're going to do it that way, that we make sure that we do have some reporting metrics that come back to us, either through quality or to the board as well.
Amanda, my thought on that is, what I'm trying to do is distance this from that process exactly, because we look at performance metrics and quality measures on every one of our budgeted items every single year. And we do that because we have discretion. We're being able to change that or not change that or amend it. In this case, we don't. So what I'm really, my goal here is to simply say, look, this is not a JPS oversight. This is not something JPS board wants to be responsible for or wants it to go through us, because we have absolutely no say in this. So my point is, I'm the opposite. I don't want it on any of our quality metrics. I'll trust GK and the commissioners to put the right metrics on it, because they're the ones that deal, with the performance, and they're the ones that deal with the entities that spend the money. We don't. We are so far removed from this. I want the complete opposite. This is their decision. They check the quality measures. They're the ones that look into it. And let's not even give the public the perception that JPS somehow has some discretion over this, because we don't.
Yeah.
Thank you for that.
This is Dorothy, and I agree with Trent. MHMR, those are not our physicians or anything, so I don't see that we need a report on them. This is between how the county would be evaluating their care.
Yeah.
Thank you for those perspectives. Yep.
Any other questions or thoughts? Yes, sir, Ms. Powell.
I echo what Trent said. You and Trent have had this conversation with our years on the board. It seems a waste of GK's time and the board's time. We support what they're going to do. It's their call. And I agree with you. I don't think we're against what we're doing. We're just against the process where we're approving something where we don't have the final say. And you're right. Each year it's awkward. It seems when the GK comes out, has done a good job in the past of presenting that. We always get back to the same decision. We're going to support whatever that amount is without going through line to line item and making decisions. So I agree with you, Trent. I think, we just need to move on. They utilize the funds as they see fit at the Commissioner's Court, and we go on down the road.
I want to, Mr. Chair, if I could, and Dr. Weber, I appreciate your questions, Charlie, your comments, and Trent and I and Mr. Montgomery have had discussions about this, and I've had discussions with Mr. Manius, and I think that's absolutely the right thing to do, and that is JPS in no way wants to be a roadblock, nor do we want to be a roadblock to the services and what MHMR or any of the other entities face. And to Trent's point, we have, you all as a board have required us as staff to always have key performance indicators and metrics to what we do. And I think, Trent, your point's well taken, and that is JPS does not set the metrics for this, and the metrics should be set by the county. And I think, Mr. Manius, you've indicated in the past that you're very comfortable with that. And I think we could probably have a really positive resolution. So you may want to comment just to make sure I'm not trying to put you on the spot, but this is the first time the board's really had this level of discussion. And I think it's positive. So you might want to weigh in to make sure we're all on the same page.
Thank you, Robert. I agree with you. I think that we all now fully understand how this process works. And let me just say that I really appreciate what the hospital district board does, not only this, but everything else it does. We're partners on these things. And so I'm in full agreement with what Trent said and echoing everything the board said. I would like to make one comment, though, if it's okay. After we finish this particular item, have any problem at all paying out of my own pocket some background design for the chairman's web, deal?
That's been offered many times. He keeps turning it down.
GK, we're going to use that as an auction item because we think we can raise money.
I will buy it as long as you don't duplicate it.
I'll send you a couple of copies, GK. How about that?
Sure.
Mr. Chairman?
All right. Yes, sir.
Just one thing I want to say. I think we're all kind of saying the same thing. We're not questioning what the commissioners are doing. I don't want anyone to, I don't think I do, I don't think the board does either, am I speaking to the board, have the perception that we're trying to think the money's not being used for the right causes. In fact, GK, you've made it clear in the past, you've come out, you've gone through that budget, there were questions asked about this and that, and the end number still went the way I think it should have. But we could also be sitting here, we also don't look at that budget and say, should y'all be doing more? We trust the Commissioner's Court to take those dollars and utilize them and allocate them as they're intended. So I don't want anybody to think that the reason we think we ought to be voting on this because we think maybe you're spending the money in the wrong place, or maybe it could be spent better. Maybe you need to spend more money. I go back to what Trent and I know we discussed in the past. I just think it is a pass through, and that's an easy way to do it. If everybody's fine with it, I think that's the direction we ought to go.
Did you just make a motion, Mr. Powell?
You can utilize that as I make the motion, Mr. Chairman.
We have a motion by Mr. Powell to approve item N. Do I hear a second?
I'll second it.
Second by Dr. Weber. Without further discussion, all in favor of the motion, please say aye.
Aye.
Opposed? Hearing none, motion passes unanimously. Thank you, everyone. Thank you, Mr. Manius.
Thanks, JK.
Mr. Chairman, thank you for taking this out of order so that I could have participated. Appreciate it.
Absolutely. Happy to do it.
We had your office redecorated while you were gone, JK.
It better not be orange and white.
That's burnt orange and white to you, sir. All right, let's move to item 4, Ms. Clark, CFO report.
Thank you very much. I'm going to try to find the maroon and white background for next finance committee. So I have some compadres that I'm sure can help me on the committee to do that.
I just want to point out that there'll be a mutiny if you do that.
Really? Okay.
There's at least 2 Aggies on this board.
There is. Yeah, there's a couple of Longhorns as well. So keeps us on our toes, right?
There's 3 Longhorns on this board. Thank you.
Yes. So, yeah, we have every year, part of my work is to closely coordinate with our rating agencies. We have the opportunity usually in the December, January timeframe, so the audit is fresh, to visit with Standard & Poor's and Moody's, who have historically, for decades, issued our credit reports effectively. And the S&P report is now on your portal. It was issued about a week ago, and I did want to tell you, I feel like it's a very positive report. They did reaffirm our AA rating with a stable outlook. So if you read through that report carefully, it does talk about how the timing that we may be issuing our debt, any upcoming master facility planning. And again, S&P and Moody's both do that. Now, I don't expect the Moody's report to be out until February. They got a little bit later start than S&P did, but I'm very happy to share that report with the board this morning. And if you have any questions, please feel free to give me a call or an email, and we can discuss that. So that was really my announcement for the CFO report, and I can go ahead and go into the December financials.
Any questions for Sharon on that before we move on? I guess not. I think it's really great. I'm really happy about the S&P piece. That's nice.
You bet.
Yeah.
Good work. Good work.
Very positive step. Thank you.
If you haven't had a chance to look at it, when you get some time, just at least read the executive summary. It's very insightful about, in my opinion, how the management's run, how the administration's running and managing this organization, and how the continuity of management is really weighs in on that. And so I think Robert and the team are to be applauded for that. So read it if you get a chance.
Thank you. Okay, so in your package, you actually have the months of November and December, but I was going to save some time this morning because November and December look very much the same from a financial performance. They're both highly positive months. And as we start to go through these statistical graphs, you can also see that they looked a lot the same from a volume standpoint. So not much change in the first quarter of our year. Again, this is 3 months in. We start our fiscal year on October 1st. So up in the top left, you can see admissions are pretty steady for this quarter. We are slightly below our budget by about 15%, but you can see that on the bottom 2 graphs, our case mix index continues to be about 9% above where we are, and this measures the acuity of the patient. We're also about 9% over year to date, so it's been a very intense quarter for inpatient population. The length of stay is starting to trend back to a correlated about 10% above budget. So as patients are more acute, you can assume that they will stay and be approved for a longer stay. Next slide, please. Our emergency department, again, has been very consistent for the first 3 months of the year, and our urgent care visits have not recovered to their pre-COVID levels. We do still have limited inpatient access, and I think just the perception of coming into the urgent care facility in the main hospital deters some people. But as you can see on the right-hand side of the page, we are doing a great job with our primary care and specialty visit volumes. And a large part of that, the striped part of the bar, represents what we're doing from telehealth visits. So if you look at primary care, we are about 4% over for this month, and 55% of that volume is done through a telehealth or virtual visit. Specialty clinic visits are at about a third telehealth visits. So that's very positive for our patients and social distancing as well. Next slide. At the bottom of the page, I'm excited to see the return of the surgical volume. Now, if you look at the red line, that's kind of where we budgeted what we thought would return. We have opened up, especially on the elective outpatient side, earlier than we budgeted. We actually thought we would have a bigger bump in January, but we have seen a return in October as we open up those schedules. So outpatient surgeries are about 30% where we thought they would be, and inpatient is over about 12% this month.
Sharon, this is Trent. Can I ask you a question on that?
You bet.
It looks like the trend line on outpatient surgeries is in the wrong place, because we go all the way back to 19 actuals. To budget at 500 when in 19 we were at 700. I'm not sure I understand that. Why doesn't that trend line reflect more of actual experience?
So if you're talking about the red line,
yeah,
that's actually budget 21. It is not meant to be a trend line.
Oh, okay. So that's the overlay of 21 against the last three.
Yeah. Well, so the bar charts are the actual numbers. So gray represents 2 years ago. The cream color, the center for Robert, is the actual, and the darker blue line is what we've got for actual for 21.
Okay.
And the red line is actual, it's the budget for 21. So you would compare that red dot in December and see that the blue bar is higher than our budget.
Okay, so we're outperforming all along then in terms of surgeries and obs cases and everything except invasive labs.
Correct. And invasive labs, we're not trending too far behind, but yes, it's a little bit lower this month than we anticipated.
Okay, thank you.
You bet. If there's no more questions, we'll go to the next slide, which is our psychiatric statistics. We're down a little bit with patient days. There has been some COVID impacts to being able to get patients in and closing some of these units temporarily. So our days are a bit below budget. But you can see that our visits are just about on budget for the month. And that represents, again, about a third telehealth for our psychiatric patients. ED visits continue to be high, and our outside medical services, because you saw the decrease in the patient days, that overflow goes to the outside medical services. So that blue bar was really high in December as we accommodated patients around our capacity. Next slide, please. Financial metrics continue to be strong. December days cash on hand are 279 that are available. This does not include our earmarked construction fund. And about 50 of those, you can see in the striped bar, is representative of the CARES Act money that we have not yet recognized as revenue, as well as the Medicare advance funding. So we just wanted to call out in that graph, those are not yet ours to keep, and they have not been recognized as revenue. Our net AR days continue to be very, very competitive. We are at 41 days. We've hovered there for October, November, and December. And our FTEs per adjusted patient day are slightly higher than our year-to-date budget of 5.96. Next page. This is our payer mix graph. Again, it doesn't change a lot year to year, but this is a year-to-date look at how charges are distributed amongst our payers. And the next page is the connection enrollment. I did want to point out we are just over 48,000, and it has been about 4 or 5 years since we have had this many enrollees in the connection program. So Michelle Haynes and her staff work very diligently to get through these applications as they come in and get people quickly approved. Next slide, please. Our income statement, again, we had an incredibly favorable month. We had budgeted about 10.4 million. We came in at 4.6 million. If you look quickly at the variances, it's all top side this month. We had a slightly favorable payer mix. We've also had an increase in CMI that I pointed out of over 9% for the month. We are still receiving kind of a higher payment for self-pay patients through HRSA. When we did our budget, we had assumed that those payments would end, but they have been extended, as well as a 20% increase for those COVID patients that receive Medicare. So 5.8 million of that 4.6 million is attributable to our revenue cycle efforts, as well as some concessions that have continued on from governmental payers. So a very positive month. Our salaries are down both this month and year to date, you can see. And then the purchase service for December is really more of a timing issue. You can see that we're right on budget year to date for the 3 months. Our supplies are higher than budget. Most of that is around the increase in the surgical cases and the return of the clinic volume. Year to date, we're at 38.6 million compared to a budget of 29 million, or 9.4 million favorable. If we can skip to, oh, I'm sorry, is there a question?
Yes, ma'am.
Steve, I can't hear you.
Well, because I am unmuted. That's why. Two items going forward, maybe for future committee meetings. 2 things you just highlighted, I think, are really important and great success stories, but I think we would all benefit from understanding better. And maybe we could do for the next 2 committee meetings, have a short session where Michelle and her team come in and give us a quick overview of how they do their connection enrollment and, you know, do the qualification and all that. Just give us a quick review of that. And then also maybe the rev cycle folks come in and talk a little bit about the art and science of what they do. I think, because those are 2 great success stories that you've just highlighted that I think we would benefit from knowing more about.
I would love to do that. We try to get Michelle Haynes before you guys every 12 to 18 months, so it is time for her to come back in. I failed to mention that because of the ACA re-enrollment, they're extremely busy in December and January trying to get people re-enrolled for Connection and Connection Supplemental that are impacted by those programs. So it'll be a very timely meeting for her to come in. I've also been working with Rory, knowing that I'd like to get him in front of this committee to explain some of the recent changes and some of the drivers of these positive revenue impacts that we've seen. So.
Okay, well, that's a to-do for you and I for the next agenda. Let's do that.
Thank you. Any other questions before I move on to a claim? All right, if you will flip 2 slides. One more. All right, so for a claim, when you start to look at their statistics, they are above the red line, the budgeted amount. So about 3% ahead for encounters for December, about 4% ahead if you looked at the first quarter. So a steady overage of volume there. Again, they have a heavy impact of those telehealth visits that we were talking about. About a quarter of their total visits are virtual. If you look down to the right-hand side of the page at the bottom, the net operating expense per encounter, you can see that we are favorable and we are under budget about 8% for the first quarter. So 2 very positive graphs that are pretty correlated. So next page. I'm gonna skip this graph. This is in here always for just a visual representation of all of the different specialties that we have along with recruitments in each. And the next page. So for December, the claim physician group has had a positive month. They ended at 3.2 million compared to a budget of 4.4 million, or about $1.3 million ahead of their budget. And that brings their year to date to almost $4 million ahead of budget for the quarter. A lot of their savings and positive impacts, again, if you look at the year-to-date column, is the volume that's in the net patient service revenue as well as the mix. We've had a lot higher surgeries, which are our bigger revenue generators. And then you can see they have had some expense savings of about $1.8 million, and that's just kind of scattered throughout. I do think that the benefits number is more of a timing that you see in December, and I thought that number will slowly come back towards the budget as we approach September. Are there any questions on a claim? If you'll flip to the next page, this is kind of an overall look at how we are doing as a system. So if you look at the very right-hand column at the total, you can see that a combined number of 30.7 million compared to a budget of just under 17 million. And that is the end of my prepared comments for December.
Okay, well, why don't we go ahead and vote to accept this or not, and then we'll move to item B. I don't know how you want to address November, though, Sharon. If you kind of
I can give you a quick overview of November. I don't know if the guys can keep up with the slides or not, but if they will flip all the way past the graphs.
Well, before you do that, let's go ahead and do the vote on acceptance of December. So I'll entertain a motion for acceptance of the December financial report as presented by Ms. Clark.
So moved.
We have a motion by Mr. Petty.
Second.
Second from Ms. Arizola. All in favor, please say aye.
Okay.
Aye.
All opposed? Motion passes. Thank you all. Go ahead and go to the November numbers, Ms. Clark.
So very quickly, again, November, this is for the medical centers, financial performance, 10.5 million income from operations compared to a budget of 7.7, very favorable. Again, positive on volume, and about half of that is, or almost all of that overage this month again is coming from the rev cycle, and expenses are right on target for the month. If you can flip to the acclaim income statement, it's going to be about 3 more pages. One more and one more. So for acclaim, again, this looks a lot like the December month that I just covered. We have 2.7 million compared to a 4 million loss. 1.3 million favorable operational margin performance for acclaim. I'll be happy to take some more time on November if you would like.
Any questions for any item on November financials for Sharon? Hearing none, we'll go ahead and move or I'll entertain a motion for acceptance of the November financials as presented.
Move for approval.
Motion by Mr. Nguyen. Do I hear a second?
Dorothy, second.
Second by Mr. Bose. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you, Ms. Clark. We'll move on to item C.
So I'm going to talk about items C and D together, and I think under the new process we can talk about all of my policies, and then you can take a motion for the prior 3. Is that correct, Daphne? Are you good with that? Give me a thumbs up.
Yes, just as long as they can ask questions about
yes.
it. Yep.
So I think I can. I'm sorry.
C, D, and E together?
Yes, I can do that.
Man, I've never been able to do that. That's awesome. Thank you.
So, policy C and D are very interrelated. I am asking for archival of a very old policy in C, the 5100. This used to kind of represent our old charity policy. Back on January 23rd, the board has already approved the new presumptive charity policy, 7300. In the review for the archival of the first policy, we had some very minute changes in the second policy, more verbiage around is it JPS versus the hospital district. So we are asking on the first one to archive because it has been replaced by policy 7300. We are asking you to reapprove 7300 because of the legal review that happened during that archival process. But I'll be happy to answer any questions on either one of those policies.
Any questions for Sharon? Hearing none.
The third policy under item E is near and dear to my heart. It's LDF 1900, which is the selection of an external audit firm. This had not been updated in a very long time, and if you see the red lines, most of the change is actually lifting the policy out of the procedure document. So now you have 2 separate as our current format. Within the procedure, I did make sure to update that we would go out for RFP at least every 5 years. So that will be approaching, I believe, this year. Our current auditor is BKD. We talked about the current process that the administration selects, and then it is brought as a recommendation back to the Finance Committee and the full board. And we did say and reiterate kind of the obvious that the auditor does need to understand public hospitals in Texas, supplemental funding practices. So those three are what we are approving, asking for your approval today.
Okay. So we've got a lot thrown at you now. Any questions for Sharon?
Sharon, Trent, so everything that's eliminated from 1901, is that now deferred back to the more recent board decision in terms of the process and the procedure? Because we've eliminated all of 1901 and we haven't replaced it with anything.
So 1900 is the policy that the procedure that got lifted out. There is, I believe, a copy of our procedure for 1901 that takes a lot of what was, we kind of separated it into two documents.
Okay.
And then I went over the three major changes to 1901, but the board does just vote on 1900.
Okay, procedurally, we don't have to have 1901 is what you're saying.
Not from a procedure standpoint, a policy standpoint. 1901 is the supporting procedure behind 1900.
Yeah, and my question was, we've eliminated it completely. I mean, it's basically all redlined out now. So does that mean there's anything that changes from the board's perspective in terms of those procedures, or are we saying the board doesn't need to review those procedures?
The board does not have to approve the procedures. You only approve the policy, but we always include the procedure behind the policy in case there's something in there that you would like to comment on.
Okay.
Okay. Any other questions for Sharon? So we can take C, D, and E en masse, right, Counselor?
That is correct.
Awesome. I'll entertain such a motion.
This is Zim, move to approve.
We have a motion by Mr. Zimmerman. Do I hear a second?
Second.
Second by Mr. Nguyen. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, gentlemen. All right. Sharon, item F.
Hi, we have under item F a contract that is an exception to bid, which is why you are looking at it today. It is a $40,000 two-year contract for a total cost of $80,000. And TransUnion has historically been doing our bad debt review for the last few years. The bad debt review impacts our cost report filing. We had assumed it would be okay just for a 1 year, and TransUnion really wanted us to have a 1 year with a 1 year extension. So we do not have to review for more or renew for more than that term, but it does trigger an exception to bid from a board standpoint.
Okay. Any questions for Sharon on this item? And the reason we have it, even though it's not listed here, it is an exception to bid, correct?
Correct. The agenda did not reflect the exception to bid, but we're actually just voting on the approval of the contract with an exception to bid. So Daphne was fine. The executive summary reads correctly.
Right. Okay. Well, with that exception to bid noted, would anyone like to make a motion on this item?
Move for approval.
Motion by Mr. Nguyen.
I'll second it.
Second by Dr. Weber. All in favor, please say aye.
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 Opposed? Motion passed.
Mr. Chair, I'm going to abstain because the chief operating officer used to be my employee.
Oh, okay. So we have one abstention, please noted for the record. Thank you. But the motion passes. So we'll move to item G. Dr. Duncan.
Hi, good morning, everyone.
Morning.
All right, I'm coming before you to consider approval of the contract between Guidehouse and the hospital district to complete the in-depth analysis of a claims operation and performance. This was a competitive bid process. We had 17 respondents and Guidehouse rose to the top. I'm asking for approval of both phase 1 and phase 2. This is unbudgeted.
Okay.
Approval.
We have a Motion by Mr. Nguyen, second by Mr. Powell. Before we do that, before we take a vote, any questions for Dr. Duncan? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, Karen.
Thank you.
Mr. Chung, item H.
Yes, here before you to consider approval for 1, exception of bid, and 2, approval of a purchase agreement for between the district and Quadell Corporation. This particular contract is for a purchase commitment of $48,000 annually over a 3-year term for our point of care reagents that we use to test for flu, RSV, and strep. The contract does have a 30-day no cause with written notice termination.
Okay. Any questions for Doug on this? And the reason it's before us because it's a exception to bid, so we'll need that in the motion. Entertain a motion on this item.
Move approval to the exception of bid and approval of the purchasing agreement.
Thank you for saying that right, Mr. Bose. I wish everybody would follow your fine example.
Second.
Second by Mr. Zimmerman. All in favor, please say aye.
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 Opposed? Motion passes. Thank you, Dorothy. Item I, Mr. Lane.
Good morning, everyone.
Good morning.
Mr. Chairman, if I may, I don't know what all the hullabaloo is about your background, but I think it's exceptional in every way, and I think you should keep it and disregard the noise.
You're a good man. I don't care what everybody says about you.
Thank you for your time, Adam, at JPS. We wish you all the best.
All right, bye. I come before you this morning to speak about our waste management stream. This was a RFP that went out. We had 2 respondents. This is for waste management services. We are in a month-to-month scenario right now with waste management coming off their previous contract. This is an 8-year term total, 5 years with 3 renewal options at $1.3 million a year, $10.4 million total. And if I may, in their previous contract, they have done very well. They have improved our recycling content from 12% to 33%. They have taken on now 12 waste streams, and they have protected JPS, and they are tracking all our contaminated loads and filing with the EPA for us. We highly recommend this contract due to their performance.
Okay. Any questions for Adam? So this is an 8-year contract where we've got, what is it, a 90-day out?
That is correct, sir.
Okay. So it's like a 90-day contract, but we're locking in the price for 8 years.
That is correct, sir.
I like that. I'll entertain any questions, other questions for Adam? I'll entertain a motion on this item.
So move.
Motion by Ms. Arizola.
Second.
Second by Mr. Nguyen. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you. Item J, Mr. Lane, you're still up.
Yes, sir. So in previous planning committee and finance committee meetings, we have discussed the $10 million infrastructure program and the 3 projects within that. I come before you today to ask for approval of the budget of the first of those. It's $2.5 million for the chiller project and to provide redundancy for a chiller system. It is to provide 1 supplemental chiller with train, new electrical service to support that chiller, decommissioning of the old chiller, as well as the decommissioning of the thermal storage plant. Just as a note on this, we have spoken with Train that is within our Vizient contract, and they have committed to deliver a chiller to us before the beginning of summer so that we can have the chiller in place and operational before our peak cooling season this summer. So this will be a big win for us to get this one off the table.
You act like it gets hot in Texas in the summertime.
I don't know what you're talking about.
And this is budgeted, right, Adam?
Yes, sir, it sure is.
Any other questions for Adam?
Steve, one question. Adam, are we replacing 1 for 1? Or are we getting rid of more than 1 old chiller with this replacement?
we're getting rid of the 419 World War II chillers that we showed in the presentation, and this is one identical chiller to the existing two that we have, main chillers, so that the flows and points and controls will all be identical and will match. So this is exceptional for our system.
This brings us up to speed now for all the chillers. We don't have anything left now that's out of date and terrible.
On the chiller side, that is correct, for the main side of the street.
Okay, thank you.
Which is separate from the pavilion, which is fine.
Right.
Okay, any other questions for Adam? Entertain a motion on item J.
I'd move for approval.
Second. Motion by Mr. Powell. I'm sorry, who was the second?
It was me.
Okay, second by Mr. Petty. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, Mr. Lane.
Thank you.
Chairman.
Have a great day.
You too. So there being no further business, I guess that we can, oh, wait a second.
Yeah.
Oh, Mendenhall's got some stuff for us. All right. Mr. Mendenhall, item K.
But, Mr. Lane got a crowd-arousing introduction. I almost got cut. That's okay.
You're always the victim, David. Always the victim.
That's right.
I'm David.
There are three contracts that I'm bringing in front of you today. The first one is with NetSync and Cisco. This is a contract that we've had before the board multiple times with my tenure with JPS, and it's a renewal of our Cisco maintenance agreement through SmartNet. And this is a 3-year agreement. And to your point, Mr. Montgomery, about the out clause, we did include that in the executive summary, that the Texas DIR does a really great job of negotiating the terms and conditions of these types of contracts for us with national and international vendors. And with Cisco, they were able to negotiate a 30-day out clause for any reason. So this is in front of you, and I appreciate your consideration this morning.
That's called significant buying power there.
Yes, it is.
I have a question for David.
Yes, sir.
Yes,
sir.
What does it mean when it says additional features include the ability to assess a person's social network?
Okay, that's actually on the next one, on the continuity care management. That's not on this contract.
Okay.
So I'll be happy to bring that up with the next contract, Dr.
Got it.
Weber.
Thank you.
Any other questions for David? Entertain a motion on item K.
Move approval.
Motion by Mr. Bose. Second by Mr. Wynn. All in favor, please say aye.
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 Opposed? Motion passes unanimously. Thank you, David. Item L.
So, Dr. Weber, let me get right into what you just asked. So the second contract that I'm bringing in front of you is the continuity care management, the coordinated care management system from Epic. And what this is an integrated approach to how we do case management, care management across the entire system with Epic. We have a system within Epic, but we've been doing that with our case managers since we went live with Epic. However, it's something that we built. There's no metrics around it. There's no forecasting and trying to figure out acuity of caseloads for care managers and so on and so forth. So it really has been just kind of our development that we've done around this. This new system will obviously be able to do a lot more than what we've ever done with our case management. And the leadership of case management has been right with us, depending on or putting this together. And even though we're asking for an exception to bid on this particular contract because it's within Epic, what I will tell you is we did a technical bake-off between 3 different systems. We went to Conduit with their MIDAS system, and we also went to Arcadia with their care management system. And the leadership of case management came back and said, no, it makes more sense to do all of this within Epic with the tool set. Dr. Weber, to your point about what it means to look at the social networking side of this, as our care managers have really looked at the social drivers of health or social determinants of health, whichever one you want to be able to use, one of the things that we're seeing is people are posting a lot of things out on social media, as you well know, more than we would ever want to know. And if someone calls in and has like a depression screening, and our care managers need to be able to get into that, this new system has the ability to go out and take a look at, are there some things within that person's, if they have given, it's an opt-in part of this, if they have given us permission to look at their social media, we can see, did they have a death in the family? Did they have some other things that may be doing that they may not be recording for us, but we can see that within social media, right? But that's an opt-in thing. That's not something we do for every patient. But if they give us that ability to do that, we can take a look at other things and other drivers that are around that patient and not just what they're reporting to the physician.
Okay. It's opt-in.
That's
right.
I'm sorry, go ahead.
So if
that's
it's,
fine.
I have a question.
Yes, ma'am.
So as it's opt-in, it is a turn-off feature for everyone, because if it's
actually turned off. Yeah, it's turned off by default. And during the process of our care managers, as we develop that part of it, we will ask the question, is this something that, do you have a social media account? And we'll work that out. Is it okay for us to be looking at those types of things? It's not one of those things where we turn on. In fact, we're going to turn it off for everyone until we can develop a process that makes sense for our case managers and the patients.
Yeah, because people will forget if they consent through at the time of whatever you're doing, that they consent through for that.
Agreed.
It's just going to have to be really, really policy driven then.
Yes, agreed on that.
Agreed.
We will not turn it on until those policies are created. That is correct.
Good question.
Good point.
David,
yes.
Is it possible for you guys to use, I'm kind of impressed with what you guys used the last time for innovation type thing. Can you suggest to them as they go through the product roadmap to include options so that every month or 2 months they send out notice if they want to turn it off? They can, as a reminder.
Yeah, that's a great idea. In fact, we could probably even put that into the MyChart account, right? To remind them, so when they're logging into MyChart, they can be able to see that and opt out of that.
That's a good idea.
Okay.
That's a great idea. I'll make a note of that. We'll put that in our development cycle as well.
Okay. Any other questions for David on item L? Hearing none, I'll entertain a motion, and this needs to have the exception to bid in the motion as well, as demonstrated so ably by Mr. Bose in the prior motion.
I will be honored to Miss Dorothy.
Go ahead, DT.
See if you can do it, DT. Come on.
I'll second later. Go ahead, Dorothy.
Hey, DT, go ahead, because she intimidated me too. I'm not going to. Go ahead, Dorothy.
Move approval to the exception to bid and the amendments for the license coordination care management.
So well done. See, gentlemen, can't you learn to do that?
Yeah, we're working on it.
I'll second.
Second by Mr. Nguyen. Thank you. All in favor of the motion, please say aye.
Aye.
Opposed?
God, Dorothy, we don't have to worry about that.
I know. Opposed? Motion passes. Thank you, Dorothy. Thank you, David. Item M.
Yeah, and the final contract that I have in front of you today is the Epic Radiant upgrade for the mammography system. So we had a current system called MagView that was an outdated system, and we were building interfaces from MagView into Epic on an annual basis. And as I've come before this board multiple times before, our goal is, when it comes to clinical documentation, to do as much in Epic as we possibly can. Ancillary systems like financial systems and reporting systems, those things, we do a tremendous amount of legwork to make sure that if we're going to do it with an Epic, it can't be done by another partner, better, faster, cheaper. But this is a clinical documentation system, and we actually did, again, another bake-off between the next version of MagView for our mammography system and Epic, and this particular system won out again from a clinical documentation perspective. So in front of you is the exception to bid, because we didn't go out to full bid. We just did a technical bake-off between these systems, as well as the licensing to be able to implement the mammography system.
Okay, and it's accessible through Epic, is it not? I mean, can't you access the module through
Yes.
Epic?
Oh, absolutely. It's a single pane of glass for all of our physicians once this is live. to be able to say I'm in mammography or I'm in the regular electronic medical record. And that's the biggest thing. So nothing is lost in translation. And when we have all of these systems that we're having interface between Epic, it becomes, we support over 400 system interfaces into Epic. And we've been trying to pare that down over the last couple of years as much as we possibly can. This is another one that we will get to turn off those interfaces because it'll be directly within Epic.
Single pane of glass. I love that. That's a cool term. Okay, any questions for David on this?
David, when we implement this, will this impact the mobile mammogram that we're doing? You know, how they go out in the community and take them. Will that be a part of this system?
Yeah, actually, the clinical documentation that's going to be done is going to be done within this system. And right now, when it's done, it is not done within Epic, right? So those results are then when that van comes back or when that documentation comes back, it may be a day or two later before we actually get that data interfaced over into the clinical documentation so a PCP or someone else can see what happened during that visit. With this, it'll be documenting directly into Epic.
All right, thanks.
Great question.
Any questions, other questions for David?
What other system, third-party system that we're eliminating, David?
MagView.
MagView, okay.
Yeah, MagView is so MagView is not only a clinical documentation system, it's also a limited PACS. So we're going to be taking those mammo images, moving them to our regular PACS, and we've actually started that process already, and that then interfaces back to the clinical documentation that is within Epic.
Got it. Thank you.
Questions for David? Okay, this is another exception to bid item, so I'll entertain a motion on item M.
Move approval with the exception to bid also as well.
Look at you. Look at that right there. I knew you could do it, DT. Here's second.
Second.
Second by Mr. Bose. Thank you both. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you both. All right. Well, thank you, Mr. Mendenhall. We'll move to item 6, which is legal count report from legal counsel. Daphne, you have anything for us today?
Mr. Chair, the only thing I have is to report the number of contracts under $500,000 for the month of December, and there were 39 of those.
Okay. Any questions for Ms. Walker? Okay. Hearing none, we have some emergent items that we need to attend to pretty quickly, and we can walk through them and explain why they're emergent. But we're going to have the finance committee stand at ease, and we're going to convene as the board of managers for the following items. Let me see. Am I understanding this correctly, Mr. Early, that these are consent items?
I'll answer that, Mr. Early. These are not consent items. These are items that require the approval of the board. That notation is just on there as standard language in case we remove consent items.
Okay. Got it. I'm sorry, my confusion. So item 7A, and I'd like to recognize Doug to give us a review of the item A. Item 7A.
Yes,
we're not convened as the board of managers, correct, Ms. Walker?
Yes, and you do have a quorum of the board present for purposes of taking action.
Okay, thank you. Go ahead, Mr. Chung.
Steve made it. That's good.
Yes, thank you. So I'm here today to ask for your approval of amendment for an allocation increase for our reagent contract with Abbott ID Now. As I came before you in previous months, we have had national shortages that we've been dealing with in regards to COVID-19 testing. As companies are increasing their ability to produce more tests, we are then are given opportunities to increase our weekly allotments, and that's what this contract is doing today. So this is again an amendment up to $661,000 for a one-year term. This will actually increase our allotment from the original agreement, which was around 50 tests a week, to around a little over 300 tests a week. So a healthy increase, and it will allow us to continue to test most accurately for COVID-19 as we move forward through the pandemic.
Is that a reimbursable item since it's a COVID expenditure?
You know, I believe the way this is working, and Sharon, feel free to jump in here, but I believe the way this is working through the government is actually reimbursing for testing associated with this, and we would put this line item in kind of that CARES Act funding as well too.
Okay, thank you.
So Trent, from just as a reminder, we are working through the CARES Act and what we can recognize and what we will be able to keep. It's all still on the balance sheet. And we are working through, we've captured these expenses as eligible. We're just not certain at the moment whether we'll be able to keep the revenue. So it's part of our analysis.
Okay, thank you.
Okay, any other questions for Mr. Chung? Entertain a motion on item A.
Steve Simmons, move to approve.
Dr. Simmons moves approval. Did I hear a second?
Second.
Second by Mr. Bose. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you all. Item B, Ms. Dent.
Good morning, and thank you everyone on the board for hearing. I'm asking for an approval for an exemption to competitive bidding for the purchase of goods and services for HydroPure Technologies, and that is related to our dialysis machines, our reverse osmosis machines. I'm asking for exemption due to urgency of the need. We have a local company that's able to immediately position our request to have that equipment prepared for JPS.
And just to clarify for Ms. Dent, we did have to move forward with this so that the company could begin making those items. So we did request that approval from the board officer. So this is a ratification of that action.
Okay. Any questions for Ms. Dent? Okay, I'll entertain a motion with the exemption to bid. Senate.
This is Dorothy. I move the exception to approve the exception to the bid and the ratification and approval for the dialysis machines. Okay.
Hear that perfectly. We have a motion. And we'll hear a second.
Second.
Simmons, second.
Second by Dr. Weber. All in favor, please say aye.
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 Opposed? Motion passes. Thank you. Ms. Rachel. Item C.
Good morning. I have this is an agreement IES services group over the holidays as our number of patients increased in our COVID, we needed staffing and so we needed to execute to get help from every group to help our
Now you're cutting out quite a bit.
Okay. I'm going to move a little bit closer.
Okay.
Is that helpful?
Yes.
All right, great. Okay. This is the ratification of a contract with our emergency services group to staff our COVID ICU on a locums basis. When our volumes are high, we needed them to help us during the holiday. And so we needed to execute this over the holiday. It's a shift-based agreement with a 6-month length of time. It is a site that they don't normally cover, so we needed to get an additional contract with that group to help us cover our ICU with our intensivist.
So it just allows us to flex when we need to?
Yes. Just allows us, yes.
Okay. Any questions for Diana on this one?
Just a comment, Diana. This is a smart step. I'm glad IES was cooperative. I mean, they're right there. They're happy to help. I know that within their network, they're trying to look at opportunities to provide services in circumstances like this in all their hospitals. So I appreciate the effort to get this done, and it saves us a lot of hassle and time and keeps our patient population served immediately. So thanks for doing this.
Yes, we were very happy with them. We do, just so you know, also flex our anesthesiologists down there, and so, but this is a new group flexing down there.
Good deal. Thanks.
Mm-hmm.
I'll make a motion to approve, Steve.
We have a motion by Mr. Petty. Here, a second.
Steve Simmons, second.
I think I heard Dr. Simmons second it. All in favor of the motion, please say aye. Opposed? Motion passes. Thank you, Diana. Item D.
Hey, Steve.
Yes, sir.
Hey, it's Chet. So I've been on kind of listening and participating since I'm technically a member of this committee. I just want to make sure to abstain on that last one for obvious reasons.
Oh, I'm sorry. Yes. We'll have you abstain. Please note for the record.
Thank you.
Who was that?
That was Chet.
That was Dr. Schrader.
Oh, okay.
Thanks, Chet. Item D. Diana.
Great. This is another ratification. I did want to say, though, that since David's listening, David, you're going to have to come over and check on my Wi-Fi here at the Acclaim office building to make sure we don't have technical difficulty next time. Okay.
We just like you sticking your face real close to your
Terribly awkward. Okay. This is a ratification of the First Amendment to our service agreement with Oral and Maxillofacial Surgery Network. We have a group of patients who have special moderate sedation requirements that we cannot provide in our office space setting because of new environmental requirements through the Joint Commission and others. We have been taking care of that need in our package, but that's not a good use of that space either. So this agreement will allow us to send those patients to Dr. Stella's private office, our connection patients, to be treated down there. It does not require an OR suite. It will work better down in his office. So we have agreed to a new fee for that work to be done in his office effective January 1st.
Okay. Any questions for Ms. Rachel on this?
I have one comment, if I may, Steve.
Yes, sir.
Diana, as you move this from in the hospital down to the basement with the private offices, I would really hope there's still the quality metrics attached to it.
Yes, Dr. Stella has quality metrics attached to his contract, and so we will make sure that we monitor the patient that he sees down there as a part of that contract. Thank you for that.
Okay, and didn't we get rid of the term conscious sedation a while back?
Maybe moderate sedation or conscious sedation, correct? Yeah.
Well, it's just got under the strategic plan to move OMFS conscious sedation, and I thought we had deleted that.
We still do it, right? We've been doing it in the package for quite a while now.
No. The term.
Oh, okay.
We deleted.
What calls it? What it's called? Moderate sedation.
Okay. Would that be a motion, Dr. Weber?
I have a question.
Okay.
Oh, yes, ma'am. Miss Arizona.
Oh, sorry. Was Dr. Weber done?
Yeah, I'm done. Go ahead.
Okay. I just had a question. In moving that services to his office, is that still available transportation? Would the patient still be able to get ease of access to his office?
His office is in the basement of our hospital, his private office, so they would essentially be coming to the same location.
Okay, thank you.
Convenient. Okay, we have a motion by Dr. Weber. Any further questions? Entertain a second.
Second.
I think Zim was the second on that one. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you, Diana. Ms. Parker, item E.
All right. Hello, everyone. So I'm bringing forward for your consideration a ratification to our current contract that we have with the county. And this is for the CARES money that is provided for reimbursement for flu shots. And so what this ratification is essentially an extension of an additional month to the current contract. It's already been pre-approved at Commissioner's Court, but does provide us some reimbursement for those flu shot administrations that occur for the uninsured population. So that's what I'm bringing forward today.
And it's just for 1 month extension?
Yeah, it was just to kind of finish out.
Okay. Any questions for Joy on this?
Steve, I move for approval.
Motion by Mr. Powell,
Second.
second by Ms. Arizola. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you, Joy.
Thank you.
Ms. Walker, reconvene in executive session. Do we have any closed items that you're aware of?
I don't believe we do, but you can adjourn the full board and when you reconvene, you can reconvene as finance.
Okay, we will adjourn the full board and reconvene the finance committee. Let's see, where are we here?
Adjourn.
Oh, come on. Okay, there we go.
I'm following that chair.
Yeah, no kidding. There's no items in closed, so we'll reconvene in open session. We never actually convened in closed session. So without any further ado, we are adjourned. Thank you, everyone.
Thanks, David.
Thank you all.
comments to pose.
All right. Good afternoon, everyone. Let's go ahead and call the HR committee, the Board of Managers HR committee meeting to order. We do not have any citizens wishing to address the committee that I'm aware of. So we will move, since no one is there, into approval of our minutes. We had an opportunity to review those. Are there any corrections to them?
If not, I move for approval.
All right. It's been moved by Zim. Can I get a second?
Amanda seconds.
Amanda second. Okay. All right. It's been moved by Zim, second by Amanda. All those in favor of approving their minutes signify by saying aye.
All right.
Okay. And a no by nay. Okay. Minutes are approved. But today I'm thinking that this probably won't be long, but and I'm hoping that. Well, we have a closed item, so we might be a little lengthy in there. But our open session should go pretty fast since we're doing mostly policies. So, Alex, you're up for, I think on A, the pension benefit amendment, we need to do closed session and then come back and vote on that. That's okay? Correct. And so what I would do is go into B in the policies, okay? Who's doing the
Dorothy?
Thank you, Mr.
Dorothy, can you hear me?
Yeah, I can.
I'd like to take about 1 or 2 minutes to talk about policy 2700, protection from discrimination, harassment, and retaliation.
Okay.
But
Did you want to?
However you
Did you
want to
do that now, or did you want to wait till we get to that policy?
That's up to you.
Okay. Why don't we do a B policy and then we'll go into that. Okay.
Okay.
All right. And so who's doing the policy for me?
Will be Rihanna Pollard, our employment attorney. And just a note of mention to the board that these policies are reviewed every 3 years as part of our standard operating procedure. And today Rihanna will take us through the policies, and they have slight edits, grammatical errors, corrections. And Rihanna, I will turn it over to you.
Where is she? I don't see her.
Hi. Thank you, Alex. Good morning to everyone on the board. We have 6 policies today, as Alex mentioned. They are all up for their 3-year cycle. There are any changes to them, except a couple grammatical things that we've added to it. So I can go through those individually or as a block, however you like.
Well, I think just state the title for the first one, then we'll go into the next one, since I don't think there are any questions on it, because there was only holiday scratch, so it's no change on that one, right?
Correct.
Except that, okay? So for policy HR 600 holiday policy statement, there are no comments on that one, I believe. Okay, so let's go to C. I did, Delphine, did you want me to get them approved as we go through that way?
No, you can go through them if you'd like.
Go through them, then
You could just go through discussion of all of them and then just get approval.
Okay, all right, okay. Okay, well, we're ready for C, Delphine.
Okay, excellent.
Rihanna.
C is HR 2700, protection from discrimination, harassment, and retaliation. We added 2 words. The words were team members in our list of, we say it's important to JPS that employees, team members, and patients and visitors have an environment that is free from any form of unlawful discrimination, harassment, sexual harassment, and retaliation. Those were the only changes. So we added 2 words to make sure that that also includes anybody who's on our campus as a contractor or a temporary employee, anything like that. And then we just also called out sexual harassment as well, because that
okay. All right. Well, Chuck had some comments on that one. Go ahead, Chuck.
Yeah. If I may, most of the time I don't say much about the policies, but this one bugged me a little bit, and it has to do essentially with the word demeaning, because what it says is if you're demeaning to another person undermines the integrity of the relationship. So I decided to look up what demeaning meant. And I find that there's a bunch of definitions, but just bear with me for a minute. Demeaning behavior is now considered a form of workplace bullying. I didn't know that.
Okay.
I understand if you're acting in a superior way, or you're not open to new ideas, or you say some things that may cause a loss of dignity. But here's my little 2-minute spiel. There's a book, and it's been commented upon and apparently being used, and it's part of a chapter from a book by Darlene Price. But this is on phrases to be banned from the office or banned from presentations. And they are as follows. If you say these: it's not fair, not my problem, or I do not get paid enough to do this, I think, no problem, I'll try, he's a jerk, she is lazy, my job stinks, but we've always done it that way, you should have or could have, you guys, I may be wrong, but this may be a silly idea, don't you think, and the last one was, I don't have time for this right now, or I'm too busy, but that would also include rolling your eyes after a sarcastic comment. That hit me loud and clear about the things you're not allowed to say if that's the way we are indeed going. Because I don't live with that. I don't understand that. And that you're supposed to report them if you see them, which means you may not even be the person that's being involved, but you could just point it out to your supervisor or your resident or whoever and say, I just saw some demeaning behavior. Well, I hate to say this, but if you're going through a residency surgery program, you're going to hear a whole lot of these statements, I guess, that could be demeaning. And I fully understand wanting to keep the sanctity and the integrity of the workplace, but jeepers, I really have a problem when it comes to what I can or cannot say. So those are my comments, Dorothy, on this one.
Okay, do anyone else have any comments on that?
Hey, Dorothy, this is Zim.
Zim.
I'll be a little more direct than the chairman. All of these things are subjective. There is no definition that you can put on it because the minute you do, you're going to find another one, and it just goes on. It is such a subjective thing, and it all gets down to personal feelings. And the other thing about it that I don't like is somebody can be accused of something and not know who the accuser is. These reports can be anonymous, so it's a bucket of worms, and you can write the policy any way you want, but it's going to be a crazy thing to administer. That's all I've got to say.
Okay. All right. Is there some suggestions that we could make it better? How we could make it better?
I think insulting is something that is not allowed in the workforce, and that can be quantified, but demeaning will be tough. But you know what? Let's hear from some of our female board member. We want to get your view on that too before we make more suggestion or review this one. Amanda?
I was about to say there's only 2 of us, so it's it's not that many. You can just say my name. I mean, I think that I kind of agree with Zam on the fact that all of this is very subjective to the feelings. There's a lot of context based around, especially with harassment and attitude and in body language and in aggressive behavior. So I don't know exactly what other word choice would encompass that other than demeaning.
Yeah.
So this is Daphne. I think to the point of, it's very subjective. I think you could probably eliminate, and Rihanna, I'll defer to you, those words without diminishing what the policy is meant to do. So you could say any action that undermines the integrity of the employment relationship is clearly not allowed. So, I mean, that's just a broad statement that the board wouldn't, JPS does not tolerate that behavior. And I think if you're uncomfortable with the word, I think that you could eliminate it without losing the meaning of the policy.
Right, because Alex, I'm looking at how discrimination is reported and the process that goes through. It's a pretty lengthy process, correct?
Correct. Yes. And even though some of these actions may be subjective, I would add that at the end of the day, there are people here that administer these policies, right? And there are people here who help to protect our fellow teammates. And Mr. Early's rules of the road are really, in my opinion, at the top of the food chain in terms of policies and how we treat one another. And I think these policies support his rules of the road. And at the end of the day, we have to be sensitive to how we administer them. We administer these policies and procedures. We have to be fair. And I think that is part of our culture. And I think we have to believe that any policy we have could be administered unfairly or fairly. And if it was administered unfairly, we would handle that on a case-by-case basis as well.
Well, do you feel better if we take Delphine's suggestions, and will it meet the intent of the policy, Rian?
Dorothy, I have a suggestion, and I think it meets the intent of the policy, and that's after sexual harassment and retaliation. I would just say, such behavior undermines the integrity of the employment relationship and is not allowed.
Okay.
That would be sufficient still to meet the intent of the policy. That would work.
Say that again, Rihanna. You cut out on me.
Oh, sure. I was saying we could use that language. That would be appropriate. I don't think it would lose the meaning of the intent. We would still be able to administer it on a case-by-case basis and still enforce the rules of the road when necessary.
Okay. Zim, does that read better to you?
As I said before, you can write this thing any way you want to, and it's still going to be subjective.
It is.
You cannot write it so that you cover everything. Right. So I think the recommendation that was just made is as good as any.
Okay. All right. Any other discussions on it? All right. So why don't we go ahead and move for approval on this one, since we made some changes on it, okay? So can I get a motion to approve this policy with the changes as stated?
I'll make the motion to do that and make the language that after retaliation, it says such behavior undermines the integrity of the employment relationship is not allowed.
Okay. All right. Can I get a second?
Second.
Okay. All right. Is there any other discussion on this policy? All right. Then all those, it's been moved by Chuck, seconded by Zim. All those in favor signify by saying aye.
Aye.
Aye. Okay. Any nays? All right.
Thank you.
Okay. Thank y'all. Rihanna, you ready for the next one?
Yes. The next policy we have up is HR 400, Equal Employment Opportunity. This policy as well, very little change. We added the word sex sex/gender, just to be.
Okay.
So we're seeking approval.
Any questions on that or comments, anybody?
Move approval.
Okay. Well, you're gonna come back and approve all of these except the C as one, okay?
Okay. You got
All
it.
right. Rihanna, the next one is it labor relations?
That's correct. The next policy we're requesting approval is HR 4500, labor relations philosophy. There are only grammatical changes to this policy. Not even grammatical, we just formatting changes.
Okay. And the next one is counseling?
Yes. The next policy is HR 3700, employee counseling. This was another one where it's just formatting.
Okay. All right. Do anyone have any questions on any of that policy? Okay. If there are no questions, then Chuck, I'm ready for an approval of all the policies as submitted except for the discrimination. Okay.
Madam Chairman, do we need to call out HR 2100 too, or I just want to make sure that's the last one?
Oh, I'm sorry.
Yes, yeah.
I'm sorry, I missed that one. Yeah, go ahead.
Okay, so we're also seeking approval on HR 2100, employees working outside of their regular department and/or job code. This was another one where we shortened the policy. Otherwise, it's equivalent of what we had before.
Okay. Anyone have any questions on that one? Okay. I think that's it this time. All right. Okay. Then can I get a motion to approve policy 6000, HR 400, HR 4500, HR 3700, and HR 2100?
Recommend approval.
Okay. I think DT came in on that one first as a motion and second by Chuck. All those in favor signify by saying aye.
Aye.
And those opposed by nay. All right. That is the end of our open meeting. So now we will close the open meeting and reconvene in executive session. Okay.
A few minutes to get
let's reconvene at 1:36 p.m. into open session to complete our agenda. And we have the pension benefit amendment that we need to complete. So I'm looking for a motion to accept the resolution to amend the pension plan as presented.
So moved.
Okay, Zim.
I'll second it.
All right, it's been moved by Zim, second by Chuck for the approval to amend the pension plan as presented. All those in favor signify by saying aye.
Aye. Aye.
And all those opposed by nay. Okay, motion approved. If being no further business, then we can adjourn. And I thank y'all for your wonderful attention. Okay?
Thank you.
Mr. Bowles.
Thank you.
Okay.
See everybody.